the basic concepts and clinical correlates related with the epilepsy. And the first concept which you need to understand epilepsy is that you must know the difference between seizure and epilepsy. The very first thing, because many people think seizure and epilepsy is one and the same thing. Rather, first of all, you should know what is seizure. Then you should differentiate epilepsy and seizure from each other, right? So first of all, we'll define what is seizure. What are the spellings of seizure? S-E-I-Z-U-R-E. Okay, so this is seizure, and we have to see what are the similarities or differences with epilepsy. Every seizure is not epilepsy. The first thing which you have to remember is every seizure is not epilepsy. Today my main stress will be how not to overdiagnose epilepsy. You should have such a crispy, clear concept about epilepsy that you should not underdiagnose and you should not overdiagnose. Because if you underdiagnose a patient of epilepsy, it means the patient has epilepsy, you fail diagnosis, patient suffers a lot. But if you overdiagnose epilepsy, still patient suffers a loss. Over diagnosis mean a person who does not have epilepsy, he has some other neurological phenomenon or psychological phenomenon, and you diagnose it as epilepsy, it means you are stigmatizing the patient socially, because unfortunately society, still in modern era of medical sciences, we discriminate against the patient with epilepsy, unfortunately. Number two, when you overdiagnose epilepsy, you may be committing a patient wrongly to many years of drugs which may even produce toxicities. Because if you overdiagnose sore throat, you may give antibiotic for 5 days, no problem. But if you overdiagnose epilepsy, you may be giving drugs for a wrong diagnosis for 3, 4, 5 years or so. Is that right? So that today in our first session, our main stress is that we should know precisely, exactly what is epilepsy, what is seizure, and how to under or overdiagnose, avoid the under or over diagnosis of epilepsy. So let's first of all concentrate on seizure. Yeah, who will define seizure for me? Okay, there's one person here. What is seizure? It's not a name of a king. She's saying seizure is persistent discharge of neurons. What do you think? Your inspiratory centers are firing? Are you awake right now? Sure? Your reticular system is persistently firing? Is it epilepsy? No. Just a minute. First thing, it's a wrong definition that she is saying that persistent discharge of neurons is epilepsy. There are so many neurons in our body which are persistently discharging, and they are not epilepsy. Vasomotor centers are all the time firing. You know, a sympathetic tone is all the time maintaining the vessels in semi-constricted position. We don't say there is epilepsy of vascular system. Is that right? So just persistent, thank God there is persistent electrical activity in our brain which keeps us alive, right? So that is not epilepsy. What is epilepsy? Yes, please. Or seizure, first seizure. Okay, she said it is excessive discharge. Again, sometimes in seizure there may be excessive discharge, or sometimes it may be less than excessive, less than normal even. It's not necessarily, even though most of the seizures and most of the epilepsies have excessive discharge, but all of them do not. Yeah, what is seizure? Question goes to someone who looks very intelligent. Yes, young man from there. You look intelligent. Yeah. What is epilepsy or what is seizure and what is the difference? I think you are trying to confuse me, isn't it? And I'm sure you are failing in your effort. Right, I will not comment even your answer. He is saying, it's a very intelligent answer which can confuse even anyone. He is saying this is inhibition of, I don't know, excessive inhibition of inhibitory neurons, right? So it is just like he say excessive use of the brakes. Anyone else? Someone who is really confident, who knows what is seizure. Okay, yes, what is seizure? Okay, now she started, takeoff was very right, and then she suddenly banged. She says in her definition that it is abnormal discharge in the central nervous system. This is right. In seizure or in the epilepsy, there can be abnormal electrical activity in the brain. recognize the pattern of touch. Same is true about others. So what happens? That what really today I want to put in your mind, every seizure is not motor. Every seizure is not motor. For example, motor occur when there is problem in this area. Of course, it's too easy to understand. This is prefrontal cortex which is concerned with, precentral gyrus which is concerned with motor. Now, you know it that if this area is concerned with the leg, if this is having epileptiform focus or seizure focus, you will have abnormal movements in the leg. But if you have here maybe abnormal movement in the arm, and if you have abnormal electrical activity here, you know this area of the homunculus, motor homunculus correspond to the facial area, you may have abnormal facial movements. Am I clear? So what I really want to put in your mind, that what is seizure? Seizure is abnormal electrical activity in some part of the central nervous system. It may be in some part or whole of the central nervous system, and it may end up into some abnormal motor experiences, or it may end up into some abnormal sensory experiences, or it may end up into some abnormal psychomotor experiences. Let me tell you what are different types of abnormal motor experiences, then abnormal sensory experiences, then abnormal psychomotor experiences. All of them are seizure. Okay, you want to go ahead in detail of seizure, or first you want to know the difference in seizure and epilepsy? Yeah. You want to study first seizure in detail, or you want to know real difference first between epilepsy and seizure? You want to know the difference? Okay, that's very simple difference. When a person has a intermittent recurrent tendency to develop seizure, we say he is having epilepsy. When someone has a tendency to develop seizure again and again, we say he is suffering with epilepsy. That's so simple. So if someone has to define epilepsy in full, what is epilepsy? Epilepsy is abnormal, spontaneous, recurrent, abnormal activity in the central nervous system. This is abnormal, spontaneous, usually it may be triggered, but anyway. Abnormal, spontaneous, recurrent underline the recurrent tendency, tendency to develop the problem again and again. It is abnormal, spontaneous, recurrent, abnormal activity in the central nervous system, which may clinically manifest as, yes, abnormal motor, sensory or psychomotor experiences, which may manifest as abnormal motor, sensory or psychomotor experiences. So this is epilepsy. Experiences called seizures. So for today onward, if someone asks you what is the difference in seizure and epilepsy, you say if there is single, right? What is there? There is a single episode of seizure, right? This is not epilepsy. But if someone has a tendency to develop again and again seizure, then it is epilepsy. As I told you, most of us under abnormal circumstances will develop seizures. But all of us are not epileptic patients, because we do not have a tendency generally to develop seizure again and again. Am I clear? We'll talk about epilepsy in detail later, but you understand, you cannot understand epilepsy without having a clear concept about seizure. What is epilepsy? Simply seizures again and again. Is that right? Now, yeah? I'm going to that, right? I'm going into detail. I will come here and let you know, right? First, let's go to different motor experiences. Okay, in the motor cerebral cortex, in the motor cerebral cortex, there are neurons which stimulate agonist, there are neurons which stimulate antagonist. Now, if you develop some motor type of epilepsy, or for example, we take these ladies, if they don't mind, suppose these are all suffering with the motor abnormal experiences due to epilepsy or seizure. Okay, epilepsy, now we go. Now, one patient may have the problem only that whenever she develops the abnormal electrical activity in her motor cortex, her all body stiffens. right? It means agonist and antagonist simultaneously overfire. Agonist and antagonist simultaneously overfire, and her all the body become stiffened. Even her body may be so much stiffened, the respiratory muscle may not move. told you that temporal lobe is intimately related with the limbic system or emotional cortex. And limbic system, what is the major function of limbic system? Yeah, who knows that? What is the major function of limbic system? Question goes to madam. Yes, please. Limbic system is used to move around. These are limbs, but there's some limbic system in central nervous system. Yeah, a limbic system which is in intimate relationship with the temporal cortex as well as in the hypothalamus. Limbic system is mainly concerned with recent memory, concerned with primitive sensations like smell, taste, and limbic system is concerned with sexual activities, right? And it is concerned with especially emotional behavior, memory, emotional behavior. Just write down one sentence. That limbic system, especially in association with temporal lobe, is concerned with species survival and perpetuation. Species survival and perpetuation. You want to smell, you want to eat, you want to taste. It is species survival. And if you are thinking of all the time other gender, this is species perpetuation. One boy is looking at me that how I know his feelings. Everyone is like that. Most of the people are thinking of other gender, and it is not your fault. It is hardwired within our neuronal circuits that as soon as we become somewhat fit, mentally, physically, or sometimes financially, we are looking for. Okay? So this is a limbic system which is concerned with the species survival and perpetuation. Right? Now, we are going to the epilepsy of limbic system, and which mainly the epilepsy of temporal lobe. Right? Of course, limbic system, okay, temporal lobe has one more very extremely important function. Temporal lobe has extremely important function. Do you differentiate between fantasy and reality? You know, you have very odd type of fantasies, but you know these are fantasies, these are not realities. Are you aware of this fact? Or you confuse the fantasies and reality? Do you think normal people confuse fantasy and reality? Yes, small children. They are normal. You know, for children, fantasy and reality is same thing. That is why small children are so much fond of stories, little stories that you are not. Because small children, when you tell them stories, they fantasize. And when they fantasize, they believe this is true. And next morning, they cannot differentiate between the real story and the real event. In early life, we cannot differentiate between fantasy and reality. But as you grow up, you start learning what is the difference between fantasy and reality. For example, talk about this young man. He is in his bedroom fantasizing a big thing. Suddenly his mother opens the door unexpectedly. Do you think he will continue his fantasy, or he will stop and come to the reality and tell the mama, I'm shivering because I'm having high grade fever? And she touches and she says there is no fever. Is that right? So adult people can differentiate very clearly between the fantasy and reality. This function is done by temporal lobe. This is a function of, thank God there is an area in your brain which can tell what is your fantasy and what is your reality. This function is done by temporal lobe. Then temporal lobe has one more function. It develops a sense of familiarity and sense of reality. Sense of familiarity mean what? The things which you have repeatedly seen, when you come across them again, they look familiar to you. Even the boys have a syndrome in which they develop over familiarity. But usually, for example, if you have been seeing your father repeatedly, if suddenly your father enters in this room, you will develop a feeling which is that you are looking at a human face which is familiar to you. Or if someone enters which you have never seen, you will develop another feeling that still there is another human face but unfamiliar to you. So this function, the differentiation of new, recent or present or current sensory experiences, how to differentiate, compare and contrast with the previous experiences and determines is it familiar or non-familiar. This is a function of temporal lobe, right? Once you know these things, now let's talk about the epilepsy of temporal lobe. Temporal lobe is having which functions? It has psychological very important functions, right? Visceral important functions and sexual functions. Now, if someone develops epilepsy of temporal lobe? What kind of clinical features that person will develop? It depends on that which area of the temporal lobe is irritated. As I told you, if in a person that area in the